Mental health issues such as depression have long been conditions people just don't talk about openly, especially in the workplace. But mental illness is now the most common workplace disability in Canada. And as Kim Parley tells us, healthcare advocates say it's time to break the stigma surrounding mental health for the good of workers and Canada's economy.
Michael Bach has been an employee at KPMG for the past 7 years. And for much of that time, his colleagues had no idea he'd been suffering in silence.
I live with depression. I was diagnosed when I was about 20 years old as having seasonal affective disorder and mild depression.
Michael is in control of his condition now, but that wasn't always the case. He'd been struggling with depression since he was a teenager, and that struggle continued in the professional world when his condition forced him to take time off work.
I have had days where I couldn't get out of bed, where I simply could not stand the idea of coming to work and trying to pretend through a full day of work.
Michael's condition isn't as uncommon as you might think. According to the Centre for Addiction and Mental Health, about 10% of Canadians in the workforce between the ages of 18 and 54 suffer from mental health issues. And mental illness is linked to more lost work days than any other chronic condition. One person who's been on the front lines and dealing with these issues is Dr. Bernard Gosevich. He's the in-house doctor for a number of large corporations and has seen an increase in stress-related disorders, especially since the 2008 financial crisis.
It was quite uncommon early on in my practice to see stress and anxiety and depression, so-called SAD syndrome. Now makes up, I'd say, a very good percentage of day-to-day visits.
And the impact is felt way beyond the doctor's office. Mental illness in the workplace costs the Canadian economy $51 billion a year, and $17 billion of that in lost productivity. And those are numbers the corporate world has begun to notice, and it's led to a change in attitude.
When we first started, employers would ask, well, why don't we just fire them? Now you never hear or rarely hear that type of question. More the question is, how do we help?
Even so, mental health advocates say more must be done. More awareness, more understanding, and more support, including from our healthcare system.
You know, somebody can get a bypass operation in this province in under 2 weeks. 2 weeks. To get a good psychiatrist, try 6 months.
But for those who've been dealing with mental illness, both personally and professionally, it's not just about getting support, but gaining acceptance.
In seeing a huge lack of role models, I felt that someone needed to step up. Someone needed to stand up and say, I'm over here, I'm doing it, you can do it too.
Kim Parley, Business News Network, Toronto.
And for the last few days, we've brought on